Good day, grade 7 learners! It's another day of fun and exciting learning here on Physical Education 7. I'm your huggable teacher, Sir LJ, and join me as we unlock our new lesson for today. In the last episode, we discussed the nature and background of athletics. And now, for this episode, we are going to learn the basic skill or the proper mechanics in running. But before that, I want you to get your pen and paper and write down the important details here in our discussion. Are you ready? That's great! But before we move on to our lesson for today, let's review what you have learned so far from the previous episode. I will show you some pictures and I'd like you to identify the different types of equipment used in running. Number 1. What equipment is this? A baton or a javelin? The answer is baton. Number 2. What equipment is this? A marker or a starter gun? The answer is starter gun. Number 3. What equipment is this? Hurdles or a javelin? The answer is hurdles. Who got all the answers correctly? Very good! Now, let's move to our main discussion. As discussed in the last episode, there are at least 5 events in a track event. They are sprints, middle distance events, long distance events, hurdles, and relays. Now, let's see how these events are related to running. Running is the primary skill required in these events, but with a different intensity. For example, sprinting is a much more dynamic version of running. It is more explosive, to be precise. It's essential to pay attention to the proper running mechanics or your running form. When it comes to running, you need to remember these steps. For the body position, the head, trunk, and pelvis should be positioned along a vertical line perpendicular to the ground. The proper form will help ensure that the pelvis is in the most efficient position. Your head should be up with eyes focused 20 to 30 meters ahead. For the arm and shoulder carriage, it is necessary to have coordinated arm and shoulder movements during running, so that the torque produced by the driving of the legs is more easily absorbed. Your shoulder must move in coordination with the arms. For the action of the legs, there are 2 parts that must always be there. They are the recovery phase and the driving phase. In the recovery phase, the rear foot leaves the ground. And in the driving phase, the lead foot touches the ground. Running speed is the combination of the stride length and frequency of the stride. Stride length and body lean will increase as one increases speed. For the foot action, here are the things that you need to be aware of. In the ball heel ball action, the runner initially settles on the ball of the foot, then momentarily transfers the body's weight to the heel, and then rolls forward again to the ball for the driving phase. The midfoot strike landing, though, is suited to be more efficient over long distances because there is less strain put on the muscles of the calf. It is important to note that running can help improve our overall health condition. If you want to start running as a form of exercise, you can try to run at least 3 times a week for 30 minutes with 1 to 2 days of rest between the exercises. Don't forget to do warm-up exercises before running and cool-down exercises after your workout. Now, let's have a short quiz. Answer true if the statement is true and false if it is not true. Number 1. Jumping is the primary skill in track events. Is it true or false? The correct answer is false. Running is the primary skill in track events. Number 2. The proper form in running will help you achieve the best results in a track event. Is it true or false? The answer is true. Number 3. For the proper body position, the head, trunk, and pelvis should be positioned along a vertical line perpendicular to the ground. Is it true or false? The correct answer is true. You did great today! I hope you enjoyed today's discussion. Always remember that doing the proper mechanics in running will help you achieve your fitness goal and avoid some serious injuries. By the way, don't forget to follow and subscribe to our official YouTube channel and Facebook account. Once again, this is Sir LJ. See you again here on DepEd TV. Bye!
Today is Health Day. Gear up your bodies and minds because learning never stops. I am Ma'am Mary Ann, your health buddy. Brace yourselves because we will walk the talk here on Health Talk. Let's go! Happy Health Day, health buddies. In the last episode, we talked about the different appraisal and screening tests that are available in and outside of your school. For today, we will discuss much more of it as we talk about health services that are being offered in our school and in our community. One question that people ask most of the time, are these free or not? Well, we will answer this question for our Health Talk of the day. Health service is a public service providing medical care. It consists of medical professionals, organizations, and ancillary healthcare workers who provide medical care to those in need. Health services also serve patients, families, communities, and populations. They cover emergency, preventative, rehabilitative, long-term, hospital, diagnostic, primary, pain-killing, and home care. These services are centered on making healthcare accessible, high quality, and patient-centered. This is an effort that has been initiated by our government since they believe that a strong nation needs a healthy community. In order to achieve this, the Department of Health, or DOH, has been promoting community health in partnership with the Department of Education as well as community, barangay, government, and non-governmental organizations through a program called Primary Health Care. Come on, let's see the various health services that primary health care has. Number 1, it has a dental health program. The dental health program conducts dental-related examinations and procedures like the extraction of milk teeth and the prescription of painkillers for toothaches. Your oral health is essential to your good health and general well-being, as stated by the DepEd's Comprehensive Oral Health Program. Good oral hygiene, specifically taking care of your mouth, teeth, and gums, can help prevent bad breath, gum diseases, and prevent serious non-communicable disease. Next, we have the Medical Morbidity Clinic. Unlike a medical checkup that provides you with information on your general health status, such as weight, height, eye condition, and heartbeat to guarantee good health, A medical morbidity clinic provides free medicines for your simple health problems like stomach aches, fevers, coughs, and colds that are prescribed by medical practitioners assigned in your community or school. They also do referrals for laboratory exams and for further management in hospitals. The third service the program provides is child health care. It covers the immunization shots needed by children since their immune system is relatively weak and they are vulnerable to common childhood diseases. That is why this program gives vaccines for measles, mumps, polio, and influenza. It also aims to control diarrheal diseases caused by microorganisms by educating children about water safety and sanitation. After that, we have the nutrition program. This administers Operation Timbang to ensure that your body mass index is appropriate for your age. This process is called BMI or body mass index. In any case, if you are categorized as underweight, your community and your school will supplement your vitamin and dietary needs by providing vitamins or free healthy snacks during your recess, which is also known as school feeding. Then, we have deworming. Deworming aims to eliminate intestinal parasites such as tapeworms and roundworms in children through mebendazole and albendazole. This service is done every January and July, which have been declared by the Department of Health as National Deworming Months to intervene in the malnourishment, loose bowel, and anemia concerns of the children in the community. This is also done to improve the immunity of children nationwide, which will make them more focused and productive in school. After that, we have blood testing. I know this is quite familiar to you because I believe you have experienced this kind of service. This examines the components of the blood for possible disorders and conditions like anemia, leukemia, and blood infection. Blood testing too is also provided, which will help our doctors evaluate how well our organs are working. Next, we have mental health services. This facility caters to adolescents suffering from problems like depression, abuse, and stress. Given that from our last episode, we have concluded that being a teenager is a crucial period because of the changes you are undergoing. This will help your overall physiological well-being, not just as a student, but also as a human being. As they say, being emotionally healthy can promote efficiency and effectivity in school or in any task that you do. Lastly, we have pharmacy services. This is the place where you can see drugs and medicines prescribed by doctors and medical practitioners. It also delivers medications to health centers for easier access. Examples are medicines which are badly needed by the locals in the community. You can also see pharmacists in this facility that help prepare and assure that the medicines and doses given are correct. You can also see pharmacists in this facility that help prepare and ensure that the medicines and doses given are correct. So these are the different health services you can find in your school or within your community. Again, we have a dental health program, medical morbidity clinics, medical checkup services, child health care, nutrition programs, school feeding, deworming, blood testing, mental health, and pharmacy services. And to answer your question at the start, these health services are free for the people in our community and school because they are subsidized by the government to ensure that our health is protected. If our government is trying their best by giving these free services, why not avail and use them for the betterment of your health? By the way, do not forget to follow and subscribe to our official YouTube channel and Facebook account. Once again, I am your health teacher, Ma'am Mary Ann, always at your service. I hope to see you again here on Health Talk.